Welcome back. Breaking news out of the White House this morning. The Trump administration has announced a major policy shift that paves the way for states to seek requirements on Medicaid recipients. The head of Centers for Medicaid and Medicare Services releasing the following statement, reading in part, Medicaid needs to be more flexible so that states can best address the needs of this population. Our fundamental goal is to make a positive and lasting difference in the health and wellness of our beneficiaries. Joining us right now to weigh in on that is the president of the Foundation for Research on Equal Opportunity and Forms opinion editor, Avik Roy. Avik, good to see you. Thanks for joining us.
Hey, Maria, how are you?
Give us your take on the impact of this, insurance markets and anything else.
Yeah, so in terms of this particular announcement from the administration, the idea is this. There's a lot of evidence that people who have jobs, who work, who engage with their community, they're healthier. There's something about working, about feeling needed by other people that makes you healthier, that just makes you more alert mentally. And so the idea here is if you can incorporate that into the Medicaid program and give states the ability to actually require or encourage work, not only do you make people healthier, but you lift them out of poverty so maybe they don't even need to be on Medicaid in the end.
And is Medicaid kind of like a next logical target when we just talk about health care generally speaking? Of course, last year, the failure to overhaul the entire system, there was a lot made of that. But then at the end of the year in the tax overhaul plan, we did see the repeal of the individual mandate. So following that, with going after Medicaid, piece by piece, does that make sense just in terms of a progression for you from the administration?
Yeah, it's huge. So that repeal of the individual mandate, I think it's underappreciated in terms of how important that is. Because you remember all those headlines last year about how that Republican health care bills would throw 22 million people off their health insurance. Well, those headlines were wrong because 17 million of that so-called 22 million were people who would voluntarily drop out of the market because the individual mandate was being repealed. So you take that out. That's now part of the baseline because the tax bill repealed the individual mandate. Now you have a situation where you can reform the health care system in a way in which more people will have health insurance than before, while also tackling those entitlement spending issues that are crowding out our ability to fund every other national priority, like the military, like education, et cetera.
Avik, there was also a recent report that the Labor Department was issuing a proposal that would allow small businesses to band together to provide insurance on equal footing with, say, unions and corporations. What are some other things that the Trump administration and the agencies under the White House can do to really try and reform Obamacare and these insurance markets outside of Congress coming together and getting something done?
Just in general, let me say that there is an enormous amount of activity in the executive branch right now from the White House on down. They're really gearing up to make a lot of these kinds of announcements, to use their executive authority under the law to make changes that will improve and stabilize these insurance markets. So you saw that with that Labor Department announcement where people can band together to have group insurance or even self-insure. The announcement today out of in terms of the Medicaid program, there's going to be more announcements in terms of giving states and individuals more flexibility to buy insurance outside the Obamacare regulatory structure. So they're going to do a lot there. There's also going to be opportunities perhaps for employers to give people health savings accounts and health reimbursement accounts to buy health care in ways that the modern insurance system doesn't allow. So you're going to see a lot of those kinds of announcements. And the administration was waiting. So they were waiting for Congress to do its thing. Right now that that's all relatively settled, they're moving in and going to act.
You know, under Obamacare, the pool of those who are qualified for Medicaid was expanded, and it drove up the cost of the program considerably. Is there an opportunity to bring that back to people who truly have special needs?
Yeah, so General, this is what I was describing in this Wall Street Journal op-ed last week about how this is the most important problem that Congress can tackle this year. Obamacare, the repeal of the individual mandate, these executive orders, they at least provide a lot of relief. They don't repeal those exchanges, but they provide a lot of relief so that people can get out from under the high premiums. The big problem, the real problem that's facing the country that's threatening all these other priorities, our ability to have a solvent America in the future, is the growth of entitlement spending. And Medicaid in particular is going to grow by 64% over the next 9 years. It's going to be a larger amount of money that we're spending on that than the Defense Department, than every other line item in the budget. So Congress has an opportunity to do something about this. I think the House of Representatives is there. They're actually eager to take on Medicaid reform. Paul Ryan has talked about this. A number of other people in the House have talked about it. It's the Senate where there's a little bit more reluctance because of that 51-49 majority. They're not sure that they can even pass a budget this year.
Avik, I actually quoted those numbers on this very program a couple when that op-ed ran. The spending on Medicaid by 2025 will be close to $1 trillion. It's going to be $200 billion more than we spend on defense.
You've been raising the red flag on this for years. And the spending numbers are just mind-boggling.
Right, and something's got to get done. And quite frankly, so the Congress is going to have to do something about the spending on health care. Medicaid, Medicare, in particular.
Avik, it's
at the state level, too, by the way.
I'm sorry?
It's a big problem. It crowds out education. It crowds out
Right.
police. All the things that states are trying to fund. Medicaid is eating up more and more of that budget.
Do you think the Congress has got the stomach to deal with this in an election year?
And it's not this year, right? I mean...
The House wants to. The Senate is where they still have PTSD from last year's health care debate. So I think the House has to act first, pass something that the Senate can take up, and if the Senate believes that it's viable, then you could see some movement in the Senate.
All right, we will leave it there. Avik, good to see you. Thanks very much.
Thanks,
we will
Maria.
see you soon.